We're now going to look at some techniques to strengthen the posterior deltoid. And when we do these techniques, we're not going to be able to help getting some activation of the middle trapezius, the rhomboids, and a few others, including the infraspinatus muscle and teres minor. Now, with the posterior deltoid, this is a muscle that tends to respond pretty well to high repetitions. I believe that's supported in the literature, and if you talk to anyone who goes to the gym a lot who works the posterior deltoid, they'll probably say the same thing. You do not need to use high load. In fact, that would actually be more discouraged. What you should do is a low load, but higher repetitions to strengthen the posterior deltoid. That's what we're going to look at right here. The first technique we'll look at can be done in seated or standing, and you're going to need a TherAband for this. So what you're going to do is you're going to grasp the TherAband in both hands like you see right here, and you're going to bring the arms up to about 90 degrees of shoulder flexion with the elbows completely extended. Now, with the length of the TherAband, you might need to choke up on it a little bit like you see there to get the appropriate resistance. But extend the elbows, get the shoulders to 90 degrees of flexion, and then you're going to do exactly what you see right there. While maintaining that elbow extension and arms parallel to the floor, you're just going to horizontally abduct, also called laterally extend, the shoulders. Okay? At the end range of that movement, that TherAband should stretch and it should bump into your chest, like you see right there. After you get it to the back there, you return to the starting position. You can even apply some pulses right there at the maximum tension. Okay? Now again, the posterior deltoid responds really well to higher repetitions, low weight, or low resistance. So that being said, a TherAband is excellent for strengthening the posterior deltoids. You don't need huge barbells or dumbbells to do this. Okay? I would recommend to start shooting for about 20 to 30 repetitions of this, or you can time it for about 1 minute. This exercise is fairly similar to the row, however, the arm position is clearly different. You can do this in either seated or standing, however, I much prefer standing for this exercise. As you can see here, you're going to grasp the TherAband with both hands. The elbows are flexed 90 degrees, forearms are directed upwards, and the shoulders are about 90 degrees of flexion, as you can see right here. And then maintaining elbow flexion and the forearms vertical, you're going to retract the scapulas and horizontally abduct or laterally extend the shoulders, as you see right here. So I'm getting a little bit more horizontal abduction, basically moving my arms posteriorly in the transverse plane. But a big cue there is really retracting those shoulder blades. Like we saw in the other one, you can also add some pulses at the end range. This one is great for strengthening the posterior deltoid among some of these other muscles that you see right there. Here's another view of the same thing. For repetitions, about 15 to 30. Again, posterior deltoid, and some of these others even, will respond pretty well to high repetitions, or you can do it in terms of time and do it for 1 minute.